Okay, good morning. Or good afternoon. Thank you so much, everybody, for joining the webinar. My name is Anna Blasco, and I work for the National Alliance to End Homelessness Center for Capacity Building. I will be running your poll questions and the Q&A section of this webinar. Our presenter today is Cynthia Najendra, who is the director of the Alliance's Center for Capacity Building. The Alliance's Center for Capacity Building, if you don't know, is the Alliance's training and technical assistance arm. The Alliance is a nonprofit, nonpartisan organization that seeks to end homelessness in the United States through capacity building, conducting and analyzing research, and policy. So our webinar today is being recorded and will be posted on our website, www.endhomelessness.org. And I'll say that one more time because I think we already have that question in the question box. The webinar is being recorded and it will be posted on our website at endhomelessness.org. Okay, with that, I'll kick it over to Cynthia to kick off our webinar.
Good afternoon, everybody. So today's webinar is called Coordinated Entry and Systems Change, and we will be kind of going over some of the basics of coordinated entry and really cover a wide range of topics. And we'll talk a little bit about how we might also cover those in future webinars. So today's webinar is really about talking about how coordinated entry is really about changing your whole system, because coordinated entry done right involves a re-examination of a community's entire homelessness system. So you will probably be asking yourselves, what are the steps to getting this done? What decisions need to be made and when? And how do we just get started? So this webinar is really for helping folks who maybe have been talking about it, have heard about coordinated entry, maybe you've even done a little bit of orientation to some of the tools that are out there, but you really haven't had a good chance to get started and you're maybe feeling overwhelmed. And what we're hoping to do today is to kind of give you an overview of how to get started. So we have learned a lot in the last 2 or 3 years since people started developing their systems. And again, this is very new for most communities. So what you will hear today comes largely from lessons learned in communities that have been working on developing and launching their systems. And so from these lessons learned, we really have a good overview of the basics. So if you feel comfortable with the basics, you may want to tune into later webinars where we will go into more depth. But today's session will cover a general overview of coordinated entry systems, why you should even develop a coordinated entry system, using coordinated entry as a tool to make changes across your whole system. We'll go over the basic components of an effective system. Again, there is a lot of information about those basic components that we'll want to do a deeper dive into in later webinars, and I will give you a lot of resources about tools you can check into, but we kind of want to make sure we go over the basics so everyone kind of understands the fundamentals. And then what things you can do to get started, because you may feel overwhelmed from all of this information and you're not quite sure where to start, or you're just having trouble making actual decisions. You're in the discussion period in your community and you just really need to get started and make some decisions. So hopefully we can cover some of those areas. So
okay,
we wanted to start. Go ahead.
Our first poll question today is, how are you feeling about coordinated entry? I'm going to launch that now. So just take a quick minute to let us know if you're terrified, excited, confused, or exhausted/sad. Okay, just about 15 more seconds. The excited tab is about 55% right now. Let's see if more people log in. Okay, so I think we have 3% terrified, 55% excited, 21% confused, and the same amount exhausted, sad.
Okay, thanks, Anna. And I just want to make a comment on that. Part of the reason we wanted to check in with you is because if you're feeling any of these things, it's completely understandable. This is a pretty difficult, large systems change process. It's great that so many of you are in the excited phase. That didn't used to always be true. There was a lot more folks in the confused exhausted, terrified phase. But if you're feeling kind of a mix of all of those things, that's completely understandable and totally normal. And we're going to try to hopefully get you more into the excited phase.
Okay, so our next poll, where are you on your coordinated entry planning? So just take a second to let us know if you have not started, I'm sorry, that should say not started planning your coordinated entry system. If you've formed a committee but you haven't made any decisions yet. If your planning is already well underway but you don't have a launch date, or if you've launched regardless of whether it's going well or it's not working out so well. So we're going to give you about 10 more seconds to log in your vote, and then I think I can show everyone the results. Okay, let's share these results. So it looks like we're split between having formed a committee and not having made any decisions yet, and launched the coordinated entry and it's going well, or is a disaster. Less people have not started planning at all, and a few folks are planning but haven't and have a launch date. Okay, here we go.
Okay, well, that's great news. It's great that so many of you have started, and that even those of you who have launched, you know, if it's going well or if it's a disaster, in a lot of cases we know that it is really difficult even once you launch, even if you've been spending 2 years planning the perfect system, there's going to be a lot of things you need to change once it launches. I'm sure many of you are familiar with that. But this is kind of what we expected and what we're seeing in a lot of communities. So we think that, especially for those of folks who are in the planning phase but are just having difficulty making any concrete decisions, this is probably going to be helpful for you. So many of you, since a lot of you have already started this, understand that coordinated entry is a system that streamlines access and referral to services and housing. It's a systemic approach to ending homelessness that requires comprehensive coordination of all of your housing and services and resources in a community to really better match people experiencing homelessness to the most appropriate permanent housing placements as rapidly as possible. That's really the overall goal. And sometimes when we're planning our systems and we're having a lot of discussions, we kind of forget that that's really what we're aiming towards. And so it's a system that, again, is streamlining access and ensuring that all people experiencing a housing crisis have fair and equal access, because what we find sometimes in communities is there are people who are falling through the cracks, or there just isn't an appropriate service or a program to work with certain kinds of folks. And so this is really that all people experiencing a housing crisis have access to the same resources. And you're using standardized tools and practices so that everybody in the community is treating people in the same way, referring people in the same way, and working with each other in the same way. It's incorporating a system-wide housing-first approach to all types of programs. And this really means that people are housed quickly without preconditions or significant service participation requirements in all of your programs, right? So not just maybe your permanent supportive housing program, or it's really, and this again is part of that whole systems change conversation when you're looking at all of your programs in your community and the services and asking yourself, well, you know, where do we need to lower barriers? How do we really make our entire community housing first, as opposed to having 1 or 2 programs that are housing first? It also prioritizes home systems for those with the most severe service needs and incorporates other local priorities you might have. An effective coordinated entry process is a really critical component to any community's efforts to meet the goals of HEARTH and Opening Doors, which is the federal strategic plan to prevent and end homelessness. And as most of you are familiar with, the HEARTH Act is the statute that governs how the COC program operates, and it moves communities towards a more systemic approach to responding to homelessness. So instead of operating as a collection of individual programs in each COC and not really operating in the same way depending on the program type or model you are, communities are moving towards having a coordinated approach to matching people experiencing homelessness to, again, the best available intervention to end their housing crisis as quickly as possible. And I say best available intervention to, because we might not always have that, and we want to make sure that everyone is able to be served. So we'll talk a little bit more about when you don't have the right intervention available for someone who matched for that. These practices are really based on lessons from what actually works in communities to reduce and prevent homelessness. So we know that this coordinated approach is one that really helps produce positive outcomes, such as reducing lengths of homelessness and just reducing homelessness numbers. And so, for example, as many of you are seeing in your communities around the push to end veteran homelessness by the end of this year, you probably have been working with your VA partners, your SSVF and VASH partners, and that having a shared vision, coordinated entry, enough permanent supportive housing and rapid rehousing, and a community-wide plan that everyone shares really does move the needle on reducing and ending homelessness. And many communities are seeing extreme success with this model, and that's why a system-wide approach is really key to the success. I just want to make a note that the COC program interim rule does require that COCs establish a centralized or coordinated assessment system. And I just wanted to explain, because we've gotten this question before, that we use the term coordinated entry and coordinated entry process instead of centralized or coordinated assessment, to really just kind of help avoid the implication that COCs are supposed to centralize the process or really focus only on assessment, and that COCs should kind of look across the system and identify and assess community needs, make prioritization decisions, and kind of look beyond just assessment. So essentially these terms mean the same thing, and I just wanted to explain why we say coordinated entry. So even though it's required, and it's not a requirement that is going away, we sometimes get that question still, is it something that's really going to stick around? It's in the statute and it's in the rules, so it's not going away, and you may be evaluated in future NOFAs, and your funding may depend on what you're doing with coordinated entry. We really aren't just doing this because we have to. We're also doing it really because it makes sense. We know that it is critical to having an effective crisis response system. And I think the reason a lot of you are excited, and we've heard this from a lot of communities as well, is that what coordinated entry really provides is an opportunity for the reorganization of a community's entire homelessness system. So we've heard from a lot of COC leadership and providers that, these are things that they have wanted to do for a long time, but it's just been hard to kind of get everybody on board or really have a reason to do it. So this is really providing an opportunity to really change your whole system and examine a number of things that may need to be changed. So the key takeaway, again, for today is that coordinated entry requires changes to be made throughout your whole system. It is a great opportunity to look at many parts of what is currently happening. And you might not feel like you have much of a system right now. It might be really hard to do something like map your system. Oftentimes when we have people try to map their system, it's really just a collection of different processes and a lot of different programs, and people are doing things very differently. So this is, again, helping you make the changes you've wanted to make for a long time, and that also means that this is going to take a lot of time. This is very difficult long-term systems change. So what you're really going to have to do is try new things, take risks, have some difficult conversations, a lot of difficult conversations, because people aren't always going to want to change what they're doing, and there are people who aren't going to be want to be involved, and funding streams need to be involved, and there's a lot of things that might just feel really overwhelming, and that's completely fair. Change is very difficult, but there are a lot of things you can do to get this started. And for those of you who have gotten started, I think you have a lot of lessons to share, and at the end of this webinar I'm going to be asking for people to let us know if you have examples and pieces of your community that you'd like to share with us, because we really like to highlight that and spread that to other communities. So again, changes throughout your whole system means looking at diversion. If you don't have diversion, what does that mean? How do you create it? How do you build that in? Your intake, everyone has very different intake processes. Finding a common assessment, figuring out what community priorities are. What is your referral system going to be throughout the whole system? How is everyone going to refer people in the same way? It also means, and this is the more difficult conversation usually, is what do we want to do about different programs' eligibility rules? Some programs are going to have to change their eligibility to be able to take referrals, and that can also be a challenging conversation, but it's definitely being done, and it's really allowing more flexibility in a lot of people's systems. Outreach is definitely should be integrated into this so that everybody has access and understands how to get into the system. Crisis services and shelter, emergency shelter, crisis services are a critical part of this. They should not be left out of these conversations. They really need to be there. Everyone is going to be experiencing housing crises from time to time, and crisis services and shelter are very important. You're going to have to close the side doors. Providers are going to have to take referrals through the system, and that is, again, a lot of change for many providers, and there are a lot of different ways to get that done. Governance of the system, monitoring and evaluation, and very importantly, you need housing resources. Some folks say, well, we can't get started because we don't have enough housing resources. And what you want to do is really look at the housing resources you already have, and figure out how those can be kind of plugged into the system, and then simultaneously figure out how to create new housing resources. And you do have some upcoming opportunities to do that through your reallocation, through your NOFA competition, and some other opportunities. So very important to remember about the housing resources piece. So I think you all sort of understand the why, but for folks who haven't gotten started or need to kind of message this to other community stakeholders or leadership as to why this needs to happen, what's happening in most communities, if not, in most communities that have not yet implemented some kind of intentional system, you have a lot of different programs. You have many processes, dozens of intake and assessment protocols, different eligibility rules, and really not a very clear path to permanent housing. And that really should be the goal of your system. So this results in a lot of hardship, difficulties for both homeless households and for providers because of duplication of services, lack of access to programs, and really inefficient use of very, very scarce resources. For example, right now, a lot of housing projects will, use a first-come, first-served approach to select from clients that already are engaged in their services, and that made sense when they were sort of operating by themselves, but it also makes it difficult for them to know, whether the people that they're serving, are these the best fit for is that the right fit for the family or individual? What other housing resources are out there? It's really hard for providers to know this. So although many programs have collaboration or communication, you may have similar goals even. This isn't really true coordination. You might know what each other's doing, but you're not really coordinating. So in other words, you're kind of swimming along. You're maybe even in the same pool. Everybody's kind of doing their own thing, though. And if you're a person experiencing homelessness, this makes it really difficult to know how to access help, and it makes it hard to do your job as a provider. So coordinated entry works differently from a lot of these usual processes. Coordinated entry uses a common assessment and prioritization approach, which is making it easier to access housing and services immediately. Having shared goals and processes across providers and increased coordination means that instead of competing for resources and not knowing what housing is available across the community, these diverse organizations can really work together to develop a more unified vision for their community and be working towards the same goals. And then really identify gaps in the system, things that aren't working well, and come together and try to really troubleshoot all of those gaps. If you don't have that system perspective, it's pretty hard to do that. The coordinated entry really increases exit to permanent housing for the whole system. Again, that means that you need to have that housing on the other side, but it generally, because it's a more intentional way of matching households to housing, over time it's really creating system flow and reducing wait lists. Oftentimes people are stuck at shelter or stuck in transitional housing, and there's a lot of wait lists because there aren't the exits. So the idea is that you're sort of focusing all of your energy into figuring out how to increase those exits to permanent housing. And resources are maximized when people with the highest need are matched with the most intensive resources. We find across the country that there's a lot of folks that might be in permanent sort of housing that that don't need it or aren't chronically homeless or are ready to kind of step into other kinds of housing. So we should really be saving those intensive resources for people who are very vulnerable and using our other resources in the most effective way. So the coordinated entry will look pretty different in every community based on your population, your geography, available resources. There's some common elements that really allow for an effective coordinated system that every community should have. At minimum, your system should assess and prioritize people experiencing homelessness for housing and services in the same way, and provide expedited access to housing and resources. So sometimes when you're having conversations about which direction to take and which tool and which model, these are some kind of fundamental principles that you can come back to. Is the decision we're making kind of really going to provide expedited access to housing resources? And again, developing the housing resources, I know in some communities feels very challenging, but it really, again, is part of planning your system, and it can happen at the same time. You don't have to wait for the housing resources to come online to plan your system. It can happen at the same time. So while you're designing the front door, so to speak, you can also really be creating exits so that people don't get stuck. And through this planning and implementation of their systems, communities are using their data, the data that they're getting through coordinated entry, to figure out how much more of what they need. So they're seeing, you know what, we need a lot more rapid rehousing. So in this year's NOFA, we should really reallocate some of our funding from programs that are maybe more expensive or aren't being, turning people through as quickly or don't have as effective outcomes, and we should push that towards rapid rehousing. Or we really need this many, we have this many chronically homeless folks coming through, we really need this many permanent supportive housing resources. So that data that you're getting out of your coordinated entry can also really help you in figuring out how to find those housing resources and how much you need. So one of the basic components that you'll be designing is access. I think this is where a lot of people start and probably have many different models. All coordinated entry locations should be standardized to some extent, and the locations, the methods should offer the same assessment approach and referral protocol using a very uniform decision-making process. So no matter, there's some smaller communities that are just sort of using the same assessment tool at many, many different providers, but they're still kind of using the assessment tool differently. They're not necessarily making referrals in the same way. So policies, protocols with the system, written MOUs, these are really, really key. And having trained assessment workers or people at the site so that everyone is doing the same thing and understands how to make decisions is very important, so that a person presenting at any one of these sites gets the same assessment referral process. And no matter what, again, you really have to close those side doors. So all providers really need to be using the same process and be taking referrals from this process. Again, we will go into this a little bit deeper in later webinars, but a question that is very common is, how do we get providers to even do this? How do we get them to do the same thing across all providers? How do we get them to agree? Of course, getting folks to be at the table at the very beginning of these planning conversations is very important, but even then, it can be hard to get folks to change what they're doing. So, even if they're using the same assessment tool, we want them to be doing the same referrals and, kind of having a similar eligibility. So you can, and I'll talk about this a little bit later, you can use funder requirements and other types of ways to get folks to participate. I want to just touch on this very shortly, that you really want to think about diversion. As I mentioned before, you want to include a diversion process at your access points. There's different ways to do this. It can be part of your assessment. It can be something that happens earlier, because it's really important to know our data shows that on average, 25% or more of people who are coming into the system can actually be diverted from shelter. They have a place to stay. They don't necessarily need to come into the shelter system or become homeless. So that's very important. We're seeing much higher numbers from certain places about people being diverted, which is very helpful because you're reserving your resources for the people who are most in need. So we will probably do a later webinar that goes a little bit more deeply into this, because this can be a kind of a complicated topic. Prioritization is an important initial part of your coordinated entry planning process, and I think it can get a little confusing how prioritization fits with things like chronic homelessness and the prioritization notice that HUD put out. How does it fit with assessment? What does it really mean? It's an important initial part because you really have to be intentionally deciding who gets what. that means that you need to have a community conversation about what your priorities are. You really are assessing people in order to prioritize them for housing or services. And the reason you really have to prioritize is because you just don't have enough housing and services for everyone. If you had enough for everyone, you wouldn't have to do so much prioritization, but because you have scarcer resources, you want to reserve the most intensive interventions for the most vulnerable. And for example, using, putting chronically homeless people who are experiencing that in your permanent supportive housing. And you can serve a lot of other people with rapid rehousing and some of your other resources. So you want to be intentional about how you're prioritizing that. Maybe you have a lot of youth in your community and you want to prioritize that. Some communities right now are prioritizing veterans to help reach the end of veteran homelessness. So there's different local priorities. So what you want to do early on is really decide what factors are most important locally and use the data you have to figure out if that makes sense for your community. Orient your system towards one or two central principles of prioritization. You don't want to have so many that it's kind of confusing and it kind of doesn't make sense anymore because you're prioritizing everybody. And you want to ensure that most vulnerable or with the people with the most service needs are prioritized for assistance. Here's some examples of prioritization. This comes from the HUD Coordinated Entry Policy Brief, and there's a lot more information in that brief. I have a link to it at the end of our, we have a slide on resources. So just so you know, there's some things that people are using to prioritize in addition to their assessment tools. We will have a webinar that talks more deeply about assessment and prioritization. And just remember, people who are prioritized for one type of assistance can use another type of assistance if the first intervention isn't available. And communities should really just take care to ensure that this process doesn't allow people who are really vulnerable, who have more severe service needs, to kind of get stuck in the system or in shelters or on streets because the right intervention wasn't available. So say someone is matched through some assessment process to be someone who is best for permanent supportive housing, but you just don't have enough permanent supportive housing, or you have a very long list. So you should try rapid rehousing, or you should try, you want to make sure that that person is not on the street and not getting stuck. So try the next best intervention and kind of think about these decisions about assessment and prioritization in context. A lot of communities have case conferencing. If they get a certain score, or somebody's assessed and they don't think it's the right assessment, they come back together and try to figure out what's the next best intervention. So assessment also, I'm sure, is a place that a lot of people might be stuck in conversations. For the folks that have a committee and you are in the planning stages and are having a difficult time making a decision, this is often a place where people get stuck. People are really trying to figure out the best assessment and the perfect tool. And what we want to say is that this is an important part, but it's not the only part of your process. And so the assessment, really, the purpose of it is to gather only the information needed to determine the best immediate next step for someone experiencing homelessness, and that will get them back into housing. So what does that mean? That means that you might want to have a phased assessment. You don't want to ask too many questions up front that may not really result in a determination that's very helpful. You're really trying to figure out what's the next step, what housing do they need, and that sort of impulse to ask a lot of questions up front, which is what a lot of us do, especially if we've been working in a program that has long psychosocial assessments. Ask yourself whether those are really necessary. Do all of those questions really lead us to the next best decision for the person? Assessment phasing can be very helpful because a lot of communities have found it difficult to complete the assessment in one encounter, especially if you do feel like you want to ask different types of questions. It's kind of hard if someone walks in the door who has severe needs, or might be hard to engage to ask lots and lots of questions. So we want to reduce that kind of, the intensive intervention up front. And we might want to phase this, and a lot of communities are doing this, where they might screen for diversion. They might assess shelter needs and other crisis services up front. And then move on to identifying housing resources and tenancy barriers for the person, after a couple of days, and evaluating vulnerability to prioritize them for other kinds of assistance and program eligibility. So there's ways to phase your assessment. There's many examples of different types of phased assessments. We have one on our website, and many other communities are using this process as well. And we have a poll.
Okay, time for our poll. What can assessment do? Can it deliver perfect information, tell you who will be successful, or tell you someone's barrier to housing and prioritize that? I'll give you just 10 more seconds to fill this poll out, so hurry up and vote. Okay, I think the results here are pretty overwhelming.
Okay, so you all have figured it out. An assessment is not going to deliver perfect information, and it's really not going to tell you who's successful because, and there is a brief also that the Alliance and the HUD PD&R put together where we talked a lot about some of the different assessment tools that are out there and kind of really tried to figure out, well, can these tell us who is the perfect person for the for our programs? And it's actually very difficult. There's not a lot of questions you can ask to determine who will be successful in what program, even though we really have a lot of intuition about that. We think we know who's going to be successful, but I think we've all had we've all had folks that have surprised us. And I think it's important to remember what an assessment won't do and what it will do. So it won't deliver perfect information, and it's also not going to fix all your resource issues, right? So if you just have your assessment and you think, okay, we've got coordinated entry ready to go, well, you still need to fix that resource issue. You still need to have those housing exits. And the perfect information it's delivering is really helping you, it guides you to helping figure out how vulnerable someone is, what kind of housing barriers they need to work through, and this doesn't mean are they housing ready, but really what do we need to do to get them into housing, what do we need to work on. But we really want to focus on prioritizing people for appropriate interventions. That's really what it does. And ultimately, it's trying to kind of figure out how to inform systems change by what I referred to earlier, by using your data and figuring out, well, we're seeing the assessments say that this many people are scoring for this, or we can see that they're this vulnerable, but we just don't have the right resources to match that. We don't have enough mental health services, or we don't have a lot of services for young moms. So that can really help inform what types of resources you need. In the past, a lot of this has been anecdotal. Programs definitely see the needs, and it's you can look at different things like wait lists, but really this kind of larger system view about who's coming in, and your assessment tool can really help you do that. Can help you really design what type of system you need, what kind of resources you need to bring online, and where the gaps are. Tools are not going to change your system on their own. And as I said before, no tool is perfect. A lot of tools out there are great and do a lot of helpful things, and they really, really help guide a system. I think many of the tools that are out there have really helped communities kind of have a shared language, have had, now everybody's talking kind of in the same way and talking about priorities and vulnerability in the same way, and that's incredibly helpful. But no tool is perfect, and you might need to look beyond your assessment tool to really create these positive outcomes and create change across your whole system. So again, this means changing program rules and eligibility criteria if needed. So if you have your tool telling you, well, a bunch of people need to go into this kind of program, but that these people maybe don't have income or have substance use issues, and there aren't a lot of programs in your community that take people without income or take people who have substance use issues, well, that's going to mean that programs are going to have to change to meet that need, right? And program rules and eligibility criteria are kind of really key. Those conversations are key to helping create the flexibility to get folks into those programs. So watch for programs with entrance requirements that screen people out. That's something you'll start seeing as you start using your assessment tools and trying to refer places and figuring out how you can work through those program changes. So again, your assessment is helping you figure out what your system really, really needs to meet the needs of your homeless population. going to say a little bit about referrals. I know that this is actually a pretty complicated topic, and this is an area too where people have difficulty writing up protocols that everyone can agree on. There are a lot of policies and procedures that communities have created that you can use as an example. That can be very helpful when you bring it to your community to have something to start from. But do remember that referrals are focused on housing navigation and matching households to the best available intervention. That's really what referrals should be about, and should be very intentional in that, and not just looking for the first open bed. Sometimes it's a little bit difficult to think that way, but you want to make sure that you are referring people to the right intervention. Someone might not need, 16, 18 months of transitional housing. Maybe they just need a few months of rapid rehousing. So you want to make sure that you are matching households to the right interventions. And participating programs should ideally be accepting all eligible referrals. And I know that's easier said than done. And the COC, should have a documented protocol for rejecting referrals. So in some communities, you have to go back to what might be a coordinated entry monitoring committee or a central leadership and say, well, we got this referral, this is why we can't take it, we just don't have the room, or this person's been in our program before, et cetera. So that's something that you might have a protocol around so that rejections really are justified and that they're rare. Coordinated entry is written standards for eligibility in all interventions. Most of you are in the process or have already written COC-wide written standards, which is a requirement. So these, it should really go hand in hand with your coordinated entry written standards, and they might be really one and the same and should be incorporated. And again, getting provider commitment through changing funding requirements is something that a lot of communities have turned to. Going through the COC NOFA process, your COC leadership can use its leadership authority to say, one, COC, coordinated entry is a requirement for every COC funded program, and so we're going to make that a requirement. Maybe on the NOFA application locally, you're going to say, how are you participating in coordinated entry? How many rejections from our coordinated entry system have there been? Things like there's ways to score and evaluate programs on how they're participating. One difficult area that a lot of communities are managing is, well, what do we do with the non-COC funded programs? And this is where funders come in. This is where you have to talk to local funders, and this is why having a funders collaborative is always really helpful. But if your city funders, your county funders, and your local foundation funders don't understand coordinated entry and don't understand what its purpose is and why it's so effective, well, they're not necessarily going to change their funding requirements. So it's helpful to get them also on board, get them to be using the same types of requirements and MOUs that the COC is using to get provider commitment. And of course, you want providers to be at the table very early on, but sometimes you need to really work through funding requirements to get folks to commit and make sure that you have very clear protocols between the system and providers. A lot of times a planning effort happens and providers just don't necessarily understand what the protocols are, and so they don't change what they're doing. So it's important to have that communication and training requirement. We have a toolkit on our website called the Referral Process Checklist. It's part of our Coordinated Entry Toolkit, and it has a number of things you can do around referral process and how to get provider buy-in, but just gives you some ideas of what referral processes can look like. A quick note on HMIS. There is HUD guidance on HMIS. So you can see that resource at the bottom of your screen, HMIS coordinated entry and coordinated entry on the HUD Exchange site, and it has a number of FAQs about how to work with HMIS. But you want to try to integrate HMIS. A lot of communities are feeling right now maybe that HMIS does not really have this functionality yet, or we're not really, it can't quite help us do what we need it to do, and they're finding workarounds to use another system to collect data to just get going, because waiting for HMIS sometimes to be updated or to have the functionality, as you all, I'm sure, are familiar with, that could take a very long time. So you can use other systems. If you're a smaller community, I've seen communities using Google Docs. Of course, you have to just think about privacy issues. But there are workarounds. ideally, you want your HMIS to have this functionality. HMIS vendors have caught up quite a bit in the last couple of years, and most do have this kind of functionality, but you want to make sure that your HMIS is updated with the most recent data standards, and you can use HMIS to do at least some basic things, some like creating a community list or consolidating your wait list or things like that. There are things you can use it for. If you want to also, if you do have a pretty robust HMIS and you are really comfortable with your data, use that data to evaluate if your system is working. We're going to have, we have some tools on our website, and we will talk a little bit more deeply in future webinars about performance monitoring and evaluation to make sure that your system is continuously working. And we have a poll.
Okay, domestic violence providers can participate in a continuum of care's coordinated entry system. Take a minute to tell me if this is true or false. Okay, I'm going to give you just 10 more seconds. Okay, here are our results.
Awesome. So a lot of you think that DV providers can participate in the COC's coordinated entry system, and that is in fact true. The coordinated entry process does have protocols in place. Ideally, you should be building your process to have protocols that ensure the safety of individuals seeking assistance, and that should be all individuals, and certainly be sensitive to survivors of domestic violence. And these protocols can ensure that people fleeing domestic violence have safe and confidential access to the coordinated entry process and domestic violence services, and that any data collection really adheres to the VAWA rules. So you might have to be using a parallel database, but there are community examples. We have some good ones, and we had a session this summer on this, and we can find a presentation on our website about this, about how you can build coordinated entry and include DV providers. In a lot of communities, this has been a really great way to bridge the DV system and the COC system, because oftentimes those have been siloed, giving DV providers access to the homeless services system and vice versa. And so this is something that really you want your system to be as inclusive as possible. So this can be done. We do have toolkits around this. So please let us know if this is something you're interested in hearing about more. So I've said a lot, and I told you from the beginning it might be very overwhelming, but for those of you who are already in the middle of this, this all probably sounds pretty familiar, and you probably already feel like an expert in all this. But if you haven't started, or you're kind of stuck in that situation where you're just having a lot of conversations, I know of many communities that have created a committee and have been having conversations for a year, 2 years. What you just need to get started and make decisions. I mean, the bottom line is that it's not going to be a perfect system, and trying to figure out how to make everybody happy and have the perfect system on paper, generally, even when you do have that, it's going to require that you make changes all along. So you sort of want to think about this, as I said very early on, as something that you are trying and building and will make changes to. And sometimes this helps people kind of get on board, that this isn't a final thing set in stone. There's going to be continuous quality improvement. If you don't have a committee, you probably is the best way to start. You want it to be representative, but the key is that the committee really needs to make decisions for the whole COC. So if this committee is unable to make decisions for whether it's their own programs or for the COC, then it's not as helpful. It can be your COC governance board, it can be a subset of that, but it should be a decision-making authority, and the community should really, kind of figure out how to give them decision-making authority. And you can take input, of course, from the whole community and all your stakeholders, but they need to be able to make decisions, and you need to set deadlines, timelines. Because whereas HUD has, given folks, just like HMIS gave folks a few years to kind of get started, after a while it was really a requirement, it was scored, it needs to happen. And again, we're not just doing this because we have to. We are doing this because it makes the most sense for reducing and ending homelessness in our communities. So easy things to do. And I know you can get stuck in conversation, but choose an assessment tool. Choose an assessment tool, try it, use some of the ones that other people are using out there, talk to other communities who've gone through this already. Choose a model that can morph into different things, and oftentimes I'm finding, you might choose 3 access points. You might change those. You might think you need more or less, but you can set referral protocols. They can be pretty simple at first. They don't need to think about every single thing that happens. You can build off of a basic set of referral protocols, and set a launch date. This is really key. So if you start your committee, say, we are going to launch in 6 months, 8 months, that needs to be something that you figure out immediately. Again, you can start with a small pilot. You can start with a small group of programs or one population, but you really want to scale up later and try to be as inclusive as possible. If you've already started, as many of you have, and that's great, and you maybe aren't as far as you'd like to be, use the data you have from your coordinated entry process to quantify the housing need and start moving resources. So you have a NOFA coming up, and the data you're getting out of coordinated entry, as I said before, use that to help your COC figure out, well, you know what, this is just showing us, plain and simple, that we need more rapid rehousing, or more of what, we need lower barrier shelters because we just have nowhere to put folks. And so we really need to use the data that you're getting to start moving these resources now. Don't miss any opportunities. Right now you have an opportunity to reallocate to rapid rehousing, to permanent supportive housing, and that might not come about again for a while. Other communities are also using local funders to do that, to fund their coordinated entry process, to create more housing resources, but that's really a key. You need to create those exits. You have existing housing resources, and you want to figure out how to get the existing housing resources online and make them align with what your community needs. You want to create clear protocols. A lot of folks have started with an assessment tool but haven't created those protocols between the system. The providers don't know what's expected of them necessarily, and the system isn't quite sure how to monitor them. So have those clear protocols. Work to require participation, as I said before, as a condition of funding, and lower barriers of existing programs. Those are definitely things that you can be doing now simultaneously. And the message is just get started. You can always make changes as you develop the system, but you really just want to get started. One of the things that we are always looking for at the Alliance, especially the Capacity Building Center, is successes and challenges and other lessons that you are learning. The work we do out in the field really helps inform us and our tools, and tries to help us. It informs what we put out to you all. So please, email us, tell us about the successes, challenges, other lessons that you're having. If you are really proud of your system, tell us about that. We'd love to highlight it. We'd love to disseminate your tools. We don't want folks to, recreate the wheel. And we know there's a lot of success happening out there. Believe it or not, there's a lot of really effective, amazing, innovative system building going out there, and it's really exciting to see. And a lot of people are quite excited about how well it's going. So please let us know. And Anna, can you tell us what's the best email, the center email?
Yes, the center at naeh.org.
So everyone can just email the center at naeh.org, and you can find that on our website as well. So we would like to know, as I've mentioned many times now, there are upcoming webinar topics, and we have ideas about what those should be, but we'd love to know what you would like to hear. So if you can just let us know what upcoming webinar topics you might want to see, that would be great.
And while you're selecting what webinar topics you'd like to see in the future, also we're going to have about 10 minutes or so at the end of this webinar for questions. So if you've also had questions during the course of this webinar, you can enter them into the chat box as well. I'll give you just 10 more seconds to enter in your vote about what we should cover in future webinars. Okay, looks like there really isn't a clear winner here, except for community example seems to be very popular, which makes a lot of sense to me. But the other ones are pretty evenly split.
Okay, great. Well, I think you can expect us to touch on a lot of these topics then in the next few months. There are existing resources that we have on our website that may be helpful. I do have one, let me just get to this next slide, some community examples that have a pretty robust website that you can kind of look at their system, what their policies and procedures are, how they have kind of worked through the process. LA has a paper about lessons learned so far about their implementation in the last couple of years. And if you have SSVF providers in your community and generally are good partners with your VA, I would definitely take a look at what has been happening around ending veteran homelessness, because so many communities have those providers and that system already being built, and it can be something that you can learn from. It can be something that you can build off of or connect to. So I'd really encourage you to look around in your own communities for VA and SSVF providers and VASH providers and how they work together. Here's some resources as well, again, you can just, this is just a few resources, and if you have more questions about where to find things, just please email us and let us know. So I think we can take some questions.
Okay, great. Well, first of all, thank you so much, Cynthia, for the excellent webinar. I must say that one of the most popular questions is, will this webinar be posted online after it is completed? And the answer is yes. You will be able to go to our website, www.endhomelessness.org, where we will post this website hopefully by tomorrow afternoon. The second most popular question is about overcoming community politics to sort of get everybody bought into this. And you talked a little bit about some strategies to do that. Maybe you could give us a few more examples of strategies that you think are successful in getting buy-in from providers who may not be funded by HUD into the coordinated assessment system, entry system, or community leaders who don't necessarily see the importance of coordinated entry.
That's a great question, and I know it's probably a challenge in every single community, big or large, small or big. And I think that, again, the sort of getting people on board in the beginning, I think everyone is trying that. Everyone is trying to have all the providers at the table really understanding what's happening and why it's happening. That doesn't necessarily mean that people are going to buy into it. Getting community leadership outside of the COC, so sometimes we're finding that COC leadership feel a little bit alone in trying to get people to do things. So sometimes your collaborative applicant is trying to push you to do this and sort of saying like this is a requirement. But your COC governance board, and I can't stress this enough, really does have the authority to do these kinds of things. Sometimes getting the right people on your COC board, maybe that's community leaders, maybe that's funders who are funding non-COC programs, and getting those folks on board so that they're brought along this process, they understand what you're trying to do, and so that it makes sense. They don't want to be working at odds with you. So I can't stress enough sort of having the other funders at the table, whether it's at your COC board, whether you're just reaching out to city and county funders and saying, this is really kind of what makes sense for our community, and we really need everyone to be on board for it to make sense. The other thing is there's some providers that just aren't going to participate. And that's okay. You might need to start without every single provider on board. I know that can be difficult. Well, maybe the only provider in your community that provides shelter is not COC funded, and you really need those shelter beds to make the system work. Well, that can be sometimes a lot about relationship building. I know that you're probably trying to do that, but really, coming into that program and helping them understand that you're not necessarily it's a benefit to them as well. You have to paint the benefits and make those really clear to the people you're trying to get on board. And sometimes it's hard to see the benefits if you're not HUD funded, because they think, well, this is just a HUD requirement and it's just more paperwork and more assessments and we don't want to change how we do things. But we need to say, well, we can get your people into housing with our other resources. Like, how can we make this work for each other? I think that there are a number of communities that you can talk to that have gone through a lot of these political processes. I know some communities get their COC, their board of supervisors involved, or some of their other kind of political leaders and business leaders, and that can kind of provide leverage. But I strongly kind of say that try to get all the funders in the room together. If you do want some examples of communities that are working through this, and any of the ones that we listed are helpful. I know that Hennepin County gave a summer session at our conference this year, and they talked a lot about that. LA as well, very, very difficult to get everybody on board. So they might be, we can connect you to the people there who can really give you some good tips on how to really help. I know Houston especially has a lot of the folks from the city, the county, and the COC working together.
Great, thank you. I have two questions here, both along the lines of how do we pay for this. One's looking for some suggestions for some creative funding sources, and the other was wondering if you could suggest some ways to sort of talk about potential cost savings that people might experience from participating in coordinated entry.
Sure. So the first question is, as I've mentioned many times before, I really strongly encourage you as does HUD to really look at your opportunity to reallocate dollars. You have an excellent opportunity to reallocate. You even have an excellent opportunity to reallocate to coordinated entry. This was available 2 years ago. It wasn't available last year. This year, HUD again is saying, if you want to reallocate and create a coordinated entry project that can do a number of coordinated entry related activities, that can be planning, that can be a few of the things that you need done in your system, you can do that. So if you are trying to figure out how to reallocate, that even is a really politically sticky issue. We just recently did a blog post a couple of months ago, and we have a number of tools on our website. We can help talk you through that as well. You can always call us to let you know. Reallocation is an excellent tool to create rapid rehousing resources, permanent supportive housing resources, and coordinated entry resources. I'm also seeing a lot of community foundations now funding coordinated entry. The United Way in LA is the one who largely funded a lot of their stuff, same thing in a few other communities. There are community foundations who are looking to really get on board with how to build capacity in this, and so that's definitely one way to do it as well. And in terms of creating efficiencies, one way to create an efficiency too and create resources for your system is to use county and city funding. In Las Vegas, they started using their county sites, so they asked their county social service sites to repurpose some of their eligibility workers to be assessment workers. And are now using those sites, so they didn't have to build new sites, they didn't have to find new staff. They are now kind of repurposing and kind of using that as a way to create capacity for their system, and other communities who are using kind of county hubs, health hubs to use those as assessment sites. And in terms of creating efficiencies, there's a lot of things you can do to look at your system and what you're spending money on. So right now, one thing you can do, and we have some tools that are about how to assess what are we spending money on. How much money is going to this intervention, and how much money is going to intake? How much money is going to assessment? Why do we have 47 intake workers? Is that something we can consolidate? How can we create these efficiencies in our system so that we only have this many intake workers? A lot of providers are finding themselves being freed up. Now they don't have to spend a lot of time on intake and HMIS, and so they get all of that information and they can just work on case management and housing placement. So there's a lot of cost studies that you can look at from other communities and how moving some of these resources around has made their system more efficient and opened up funds really for things like housing resources.
Great. Okay, so I think we have time for just one more question. So, and this unfortunately has picked sort of a complicated one, so I apologize in advance. But this person has highlighted that there is perhaps a little bit of a mixed message between trying to find the right referrals for people for the most appropriate interventions, say someone who's chronically homeless, and finding that permanent supportive housing is the most appropriate referral, yet it's not available, and so using a more available resource such as rapid rehousing to serve that person. Could you sort of clarify that?
Yeah, I think that's the number one thing that we at the Alliance want, and I think HUD would, I can't speak for them, but I've heard them say, we don't want anyone to be literally homeless. We don't want anyone on the street, and we don't want people to be stuck in shelter for long periods of time. So if we have other resources available that make sense, and this is where, you know, sometimes transitional housing has turned into bridge housing to wait for a permanent sort of housing voucher to come about, or you know, there are a lot of examples of people who are using rapid rehousing for very, very vulnerable people and seeing quite a bit of success. So we're not saying that it needs to be either or. We're definitely saying both and. You want permanent sort of housing and you want rapid rehousing, but I understand, and you'll see this a lot with SSVF and VASH, like sometimes there are people who you feel aren't, you know, appropriate for rapid rehousing, but what we're seeing is that trying rapid rehousing, or at least using that to wait for, you know, trying rapid rehousing when you don't have anything else is a preferred option. We want to make sure that people we want to get people in housing, and a lot of times that means that they can, you know, fundamentally stabilize a little bit more, and it might really work in rapid rehousing. If you want to find examples of this, we can certainly send you some and have you talk to providers that are trying this, and they might need more time, they might need extended time. But the message is we don't want people to be on the street or, you know, waiting on a community queue because a certain intervention wasn't available. We don't want coordinated assessment to make people wait for housing resources. We want to make sure, just because the right thing isn't available, we want to make sure that they're getting housed in some way.
Great, thank you so much. So we don't have time to answer any more questions, but I just want to say thank you all so much for joining the webinar today, and we hope you'll join us for future webinars.
Thank you so much.